I'm signing here. I hereby, in terms of Section 84(2), read with Section 79(1) of the Constitution of the Republic of South Africa, 1996, assent to the National Health Insurance Act of 2023, Act number 20, and sign the English text thereof, given under my hand at Pretoria on this day, 2024. So I sign where it's written President.
The enactment of the National Health Insurance Bill has been described as a great milestone that will eradicate stark inequalities in the healthcare system. The country's first citizen says the challenge in implementing the NHI is not funds, but the misallocation of resources that gives the private healthcare sector the upper hand.
The real challenge in implementing the NHI lies not in the lack of funds, but in the misallocation of resources that currently favors the private health sector at the expense of public health needs.
Government will not implement the NHI immediately, but instead it will be implemented in phases through the National Quality Improvement Plan. Some have criticized the act in its current form, but the Secretary General of the South African Medical Association Trade Union says those opposed to the NHI only want to protect their privilege.
The privileged, those who are middle class and so forth, will find this to be uneasy, because it then represents, they speak against it in preservation of privilege. Hence you see the noise that is coming out to say, no, we can't have this NHI, we're not happy with it in its current form. So particularly what is the bone of contention is what is at the heartbeat of the NHI, which is Section 33, really, which speaks to how the fund will work when fully implemented. Where it reduces medical schemes to the periphery, really, where they'll only cover small things like aesthetics, like your nose jobs, something that is really not fundamental to healthcare per se, because the bulk of services will then be provided for through the fund. And the biggest beneficiaries of the current model are not happy with that, because it seems to represent something that they will lose their current profit margins and they'll actually become a non-entity.
The health minister further says the NHI funds will be protected through the Health Sector Anti-Corruption Forum to ensure that what happened to the COVID-19 funds does not occur again. Natasha Piri, SABC News in Pretoria.